in the year to come. We'll be facing a lot of that, and we have to be able to cope up with it. You understand many cases of COVID-19 today is sometimes self-limiting. Patient is getting better within a period of time if they have a good immune system. But those who are suffering from it, they are undergoing tremendous emotional challenges which they're not facing maybe immediately, but as time progresses. Also, if you understand, those who have been affected by it in an indirect way, maybe perhaps not from the disease, but from the emotional setbacks associated with it, again, you'll be facing quite a lot of challenges in the months to come. You'll find people coming to you with anxieties, which is there now, which will be there in months to come. You'll be facing people presenting with a lot of clinical depression because the way of life as we know it has changed. Perhaps we don't know when we'll be back to what was presumed to be normal. And you'll be facing people who will be coming down with a lot of fatigue and chronic stress. So, my friends, if you understand about a pandemic, obviously it is the cases of a pandemic, it is the number of cases which people are encountering day in, day out. Countries are encountering. That is obviously one of the parts of a pandemic. But to be very precise, you have to understand that when a pandemic is going to end, is when people have got over the emotional effects of the pandemic as well, the anxiety surrounding it, the fear surrounding it. So you have to understand there's always a physical effect of the pandemic. There's always that emotional change which a human being undergoes as a consequence of this pandemic. And I've read quite a lot about the 1918 pandemic as well. And also in those times, there were obviously symptoms and people were dealing with the symptoms of the pandemic. But it's that fear of the pandemic when that's going to go away. And that is also a very important feature. So I'll not just be sharing with you the disease or the physical effects, but a far important factor is the disease which won't be tested in the kits and which won't be come up with the blood tests is the emotional effects of pandemic. So as you understand, it's not a condition which is very prominent perhaps today, or maybe some of you have come across it. But as the months are going by, you'll find people coming down more with emotional health problems, more with emotional issues, rather than being down with physical issues. And we as homeopaths, you understand, we have a greater scope, we have a greater ability to handle that condition. Think of a person with anxieties, think of a person with loneliness, think of a person with insecurities. And you understand all these are important words which you will find mentioned in Metro Medica, irrespective of whether it's a pandemic or not. And my aim for the next 1.5 hours is going to share with you remedies with which you can handle these critical situations. Because I'm sure you have read many articles, heard many webinars about handling COVID and the symptoms of COVID. But I'll be sharing with you the road ahead and what I am facing, and I'm sure you'll be facing in today's 21st century as well. You understand, people do not give you, like, it's not a mathematical calculation. People will be giving you either symptoms of debility or symptoms of stress or symptoms of depression and loneliness is sometimes a very mixed picture, and it's important to understand the key factor as we go ahead. So, when I'm sharing with you post-COVID debility or post-COVID stress, it doesn't mean, immediately 2 weeks or month after. It can be going on for months. You think if it started in March, it's August now, so it's about 5 months, 6 months, going ahead in the next year or so. How people are going to deal with that situation and how homeopathy can help in those cases. My friends, one of the very important factors is debility. And it can be the debility, not only the mental debility, but also the physical weakness as well as a consequence of suffering from COVID. You'll find people after COVID may be suffering from acute weakness, but even long-term effects of weakness. My first remedy to help you in that condition is Alstonia scholaris. I've used this medicine very extensively and been using it, especially in this situation where patients had COVID or COVID-like symptoms. Perhaps they didn't get themselves tested, but there's a lot of ensuing debility and weakness, which is quite persistent. If you have your Borica's Metromedica with you, you'll find it's mentioned a tonic after exhausting fevers. So sometimes in cases of COVID, you're finding cases where there is a diarrheal discharges, where there is a lot of diarrhea. But after that, there's a lot of ensuing debility you'll find, and that's quite important for Alstonia scholaris. If you have a quick look in Borica, you'll see it's mentioned a tonic after exhausting fevers. And I want you to really try this medicine. If you look, I'm just reading from Borica, malarial diseases with diarrhea, dysentery, anemia, feeble digestion, a tonic after exhausting fever. So sometimes you're coming across cases where appetite has not returned, where the debility is quite prominent. And in those cases, Alstonia can really, really help you in those conditions. And it's not just there has been profuse loss of vital fluids. It's just can be, like diarrhea 2 or 3 times. And then after that, they have recuperated from the fever, or even if the diarrhea was not there, this was just the fever and they've recuperated from it. And still there is a lot of weakness and low appetite as well. Another remedy which comes very close to Alstonia is cinchona. Why cinchona? In case of cinchona, if you understand, there's a lot of loss of vital fluids. So there was this diarrhea or there was a lot of vomiting, and after that there is a lot of debility. You think of China. But in case of Alstonia, it's just the fever which has been there, and post the fever, there's a lot of weakness and there is low appetite, and that's important. And so it will help you again, post-COVID debility, which is quite important. Potency wise, you can use 6C, you can use 30C. If you're in the subcontinent, other tinctures, if are available, you can use in tincture as well. But if you're joining in for abroad, 6C and 30C are a good choice of potency to help you in this condition. And I want you to please try Alstonia. I'm sharing with you the ones which I have used and been using it in the recent times and has proved effective. My next medicine in this list is Avena sativa, another fantastic medicine which you'll need very commonly in today's condition. Think of someone A who had the viral infection or they had the COVID, and post that there's a lot of debility. A. B, post that condition, they cannot sleep, insomnia. Or, think of someone who is who is working from home, who is working 4 weeks, 5 weeks, 8 weeks, is going on week after week after week. And in that condition, where you're finding there's a lot of debility, there's a lot of insomnia, it's like a chronic fatigue, it's more like a nervous fatigue. That's why if you see in Avena sativa, it's a medicine for neurasthenia. What do you mean by neurasthenia? There's a nerve exhaustion. So not being able to continue the circle of existence. And believe me, my friends, a lot of people who are working from home, who are in the IT world, or, stuck in the cycle of work for 5 days, 6 days a week, again joining back on Monday without any changes, they're suffering from this nervous fatigue, neurasthenia with insomnia. And that's a fantastic condition for Avena sativa. So you can come across cases where post-COVID, they had a lot of debility. They are coming down with a lot of weakness. You understand any viral illness, especially in this condition, there's a lot of debility which ensues. And you have weapons at your hand to help you. People are going for tons and tons of vitamin C's and supplements, but you have homeopathic remedies at your disposal to help you in that condition. Try Avena sativa, tonic after exhausting diseases. And Avena has helped in that condition. So post-COVID, you're having a lot of debility. Secondly, in cases where there is no contact with COVID or, no contact with the patient, but still you're coming down with a lot of fatigue, with insomnia, you can't sleep, you're working 8 hours, 7 hours, normal working hours, but still you can't sleep. Insomnia, nervous debility, neurasthenia. And that's very important for Avena sativa. And what do you mean by neurasthenia? Patients will not come and tell you, I have neurasthenia, will they? But what you can get, I have tingling in my hands and soles. I have numbness, a numb feeling in my hands and feet. I feel like an ant is walking under my skin, formication. So newcomers who are joining in, young graduates, do remember neurasthenia. Whenever you come across that in the Metromedica, numbness, tingling, formication, these are the three things which comprise neurasthenia. And patients will tell you that, like a pins and needle sensation. No diabetes, no neurological condition, but it's just the effect of the cycle of existence. Neurasthenia, insomnia, that is very important for Avena sativa. You understand Avena is prepared from oats, so you won't have any adverse effects from it. If you see this triangle, hexagon, inability to keep calm, so tired and exhausted, cannot sleep. Working hours, 8 hours, 10 hours, I should sleep. I should be able to sleep, but I'm not being able to sleep. So I'm tired, I'm exhausted, cannot sleep. Especially for people who are working from home since say March or Feb. Nervous headaches, you see neurasthenia workaholics, they have not lost their job, they're in their job, they're working, they're busy executives, and still they cannot sleep. And if you see the neurasthenia part, nerve tremors, so sometimes, they're getting fine tremors. That you may not get that very immediately, but as time progresses, as the months go by, gradually nerve tremors will come in. So in case of Alstonia, you have debility, low appetite post-COVID. In case of Avena sativa, you have debility, you have insomnia as a consequence of the stress, or you can come across cases where post-COVID there's a lot of weakness as well. So that's important to understand for Avena sativa. I want you to please try this medicine. 6C, 30C is useful. Even you can use this in tincture if it's available, depending on availability. But Avena hasn't disappointed me, especially in these months of March, April, May, June, and still continuing to July and August. And who knows, you may require it even for the next year or so. I'll take up questions in the end, so I will have time for questions, so don't worry about that. Another very fantastic medicine. I'll talk about polycress later on, but phosphoric acid is a fantastic medicine which you must, I repeat, must use this in this condition, in this situation. Think of people who are stuck in a foreign country. Think of people who are stuck in a foreign city, have not been able to return home still. And one of the key factors in those cases is homesickness. So away from home, away from family, away from people, from your near and dear ones, that takes the tolls on you. Phosphoric acid is your leading remedy for homesickness. Do you remember Ignatia phosphoric acid and capsicum are your top 3 remedies from my understanding of the Metromedica for homesickness. I repeat, ignatia, capsicum, phosphoric acid. Now, when you put in perspective, those who have heard me before, those who were in the IHMA seminar last year, I've always shared this with you. You put in perspective etiology on one hand, manifestation on the other hand. So when you put on etiology on one hand, here the etiology of phosphoric acid is homesickness, away from home. I'm talking about today's condition of, the world of the pandemic. Or think of someone who has encountered grief in terms of loss, death of a near one. But what I have come across in the previous 4, 5, 6 months is being away from home, stuck abroad, stuck in a foreign land, foreign city, and have not been able to return home, homesickness. Now you put the manifestation on the other hand. What are the manifestations? Remember, for phosphoric acid, it's an acid, so debility is the key word. I'll give you 6 debilities of phosphoric acid. The topmost is obviously mental debility. I'm sure you know this. Mental debility first, then physical debility of phosphoric acid. So mental debility. How will you understand mental debility? I'm away from home. I'm working, still away from home and working. I cannot focus. I cannot concentrate. I cannot motivate myself. Loss of focus, motivation, concentration. Nobody, again, my friends, you have to understand the practical implementation. No patient will come and tell you I am mentally debilitated, will they? But what you'll find is this: loss of focus, loss of motivation, loss of concentration. And that's a mental debility. Number 2, you'll find physical debility of phosphoric acid. Physical energy is gradually getting low. And again, as this progresses over a period of time, the physical debility comes in. Thirdly, in phosphoric acid, you'll find gastric debility. Away from home, away from in a foreign city, foreign land, you're getting gastric weakness in terms of pyrosis, so water brush, heartburn, those kind of things, flatulence, sometimes even diarrhea. Fourthly, in phosphoric acid, you can get urinary debility. Again, that's not initially, but gradually as time progresses, urinary debility can come in terms of polyuria, frequent urination. Fifth, for phosphoric acid, you can get a cardiac debility, palpitations. Away from home, the homesickness, the grief of being away from a loved one. Cardiac debility, palpitation. And lastly, my friend, ophthalmological debility, your vision is gradually starting to deteriorate. My friends, I've put here neurological debility, sexual debility. Again, that is not immediately you'll find in phosphoric acid. That takes time. But again, sexual debility can come in as time progresses. So put in perspective, homesickness, away from home for a long period of time. What is the reaction? Debility, mental debility. It's a loss of focus, motivation, concentration, apathy. I used to love listening to music. I've lost that interest. Indifference to those things that used to be of most interest to him. And that's phosphoric acid. Gastric debility, water brush, heartburn. These are the things which come on more quickly in phosphoric acid. Cardiac debility, more palpitation. Vision is gradually deteriorating, ophthalmological debility. And as I shared with you, urinary debility as well, polyuria. And in this period, with the homesickness, with the grief, diabetes mellitus has set in. Do always remember, phosphoric acid is your go-to medicine, because in phosphoric acid, you have endocrinal debility as well. And that setting in of diabetes mellitus is a signal of endocrinological debility. So the grief of this pandemic, the grief of losing a near one, and you're coming down with diabetes mellitus, with the sexual weakness, with the physical weakness, with the polyuria, phosphoric acid is your number 1 remedy, my friends. I want to share this with you, a clinical tip for phosphoric acid. Do always remember, for phosphoric acid, the potency is very important. 18C, and I've used this very extensively with very good results. 18C has been suggested by Dr. Yunan. Yunan was a very famous homeopath in 1900s in Calcutta. And Dr. Yunan has mentioned about 18C of phosphoric acid. with very, very effective results. So I want you to go ahead and try phosphoric acid 18C, which I'm sure you'll benefit from that. Sometimes 1X also helps for acute weakness and debility in phosphoric acid. So 18C, please do keep a note of that. You have to pre-order it from pharmacies, and I have used with very good results, and phosphoric acid really helps with 18C. So in the present condition, with the homesickness, I'm sure you'll find avenues for prescribing phosphoric acid. If you see the hexagon here on the top, mental debility followed by physical apathy, indifferent, and the disorientation, confusion. I cannot concentrate myself and cannot comprehend clearly. Again, you won't find this developing, in 2 weeks or 3 weeks. Phosphoric acid pathology takes time to develop, maybe months, few months, and you'll find the difficult comprehension. You'll find the disorientation. What's your name? My name, it's like that. That kind of disorientation comes in phosphoric acid, irrespective of the age group. You see, I mentioned here hunts for words. That's quite classical for phosphoric acid. Another very useful medicine, my friends. I want you to try this not only for post-COVID debility, but even with COVID, if you're coming down with lots and lots of weakness, you're not being able to get a clear picture. Do remember Tinospora cordifolia. It's an Indian drug where you'll find fevers. You see, I mentioned slow fever worse in the morning, and it is known as a pick-me-up remedy when the patient has become extremely weak due to repeated attacks of viral and the exhaustion. So not only for post-COVID weakness, but even for weakness with the COVID symptoms. Say you have tried gelsemium with the debility, with the fever, gelsemium isn't working. You have tried cinchona with the fever and the debility, it's not working. Do put a note for Tinospora cordifolia. A lesser known remedy, but with very efficient results, especially in cases of debility with as well as post COVID. So those are more or less the remedies which we use for COVID and post-COVID debility. I want you to put another note and have a quick look in Boricae for this wonderful medicine, Natrum ars. Have a quick look in Boricae, please, Natrum ars. And, these are the few medicines which I've helped in the recent past with debility. I've used Alstonia, and I want you to understand the comparative Metromedica so as to be able to differentiate. Alstonia, as I shared with you, is debility and low appetite post-fever. You may question in your mind, why not China? My friend, China has got profuse loss of vital fluid. So you had a COVID where there was a lot of diarrhea, there's a lot of vomiting. After that, there is weakness, you think of China, definitely. But whenever you come across cases where it's just a fever or they had fever or they had the viral symptoms, and post that there is debility and low appetite, do think of Alstonia. I shared with you Avena sativa post-fever where there is weakness, insomnia as well. Insomnia is one of the key features in Avena sativa. I shared with you Tinospora where you have fever with debility or post-fever debility, which is important, and a mild fever, like a low-grade fever, which you'll find in many cases of COVID. So that's important. And I want you to have a quick look in Natrum ars, please. I'm just reading this in Boricae from Natrum ars. Introduction towards Zen facilitates the termination of the cold and conserves the strength and appetite. So very many cases, again, where, you have got over the flu, and not just for COVID, any viral flu, any flu-like symptoms, you've got over it. And after that, there's a lot of weakness and low appetite. Natramars is really, really useful in 30C and 200C, where you understand you have the debility like arsenic, but it is specially adapted for post-flu debility and low appetite. You have many, many other medicines, but my friends, I've had good success with these medicines, and I want you to please try this. After the cold, there is a lot of weakness and low appetite. Sometimes you'll find good results with Natramars. 30C and 200C is the potency for Natramars. I'll come to stress. Whenever you think of the word stress, and if you think of today's 2020, people have been stressed in different ways. Think of a teenager who is not being able to go to school, stressed with that, is not happy with that. Think of an adult who has lost his job, is stressed with that. Think of a doctor physician who is handling COVID patients, or who is handling so much SARS patients, is stressed with that. Think of people who are working as essential services, as cops in the police or in other government works. They're stressed with something or not. And that stress is not only anxiety, but it can be a variety and spectrum of emotions which come together. And I'll share with you, my friends, few lesson notes first, and then I'll go to the polycrest so as to handle that situation. Banerjea is one of the very first medicines which I want to share with you. A medicine which is, to be very honest, quite ignored. But I want you to understand Banerjea, because think of someone who has lost their job and depressed as a consequence of that. So he's losing the desire to live on one hand. At the same time, you're finding that person gradually losing his comprehending intellectual skills. Cognitive skills are gradually getting poor. My friends, Banerjea is a combination of natrum mur and phosphoric acid. So whenever you have the grief of a loss of a person, you have the grief of loss of a job, and along with that, your intellectual cognitive skills are getting affected, like phosphoric acid, you think of Banerjea. So why natmu? You're retaining your emotions. You're not expressing it. You're keeping it inside. And that retention takes a toll on you intellectually. That retention takes a toll on your cognitive skills. You start to develop poor comprehension, poor understanding. It's like signs of early senility is setting in, and that's important for Banerjea. So a lot of weakness and debility. with the retention of NATMU, where you're not expressing it, at the same time, the poor intellectual faculties of phosphoric acid, and that combines ambrogesia. So whenever you are confused that should I go for a phosphoric acid, his memory, his comprehension is poor, there is a bit of indifference. But at the same time, you won't expect a phosphoric acid to be retaining his emotions, because indifference doesn't cause retention of emotions. But here you have an individual where you have indifference, but at the same time, there is retention of emotions as well, in terms of I'm not being able to express my frustration to my family. I've lost my job, or, I'm having a lot of stress at the workplace because people are losing their jobs around me. And that takes a toll on you. And that's important for ambrogesia. 30C, 200C is good choice of potency for ambra. One of my top medicines, my friends, I've used in the last 3-4 months with very efficient results. And I want you to really understand and prescribe this medicine. Looking at the news, today it's 60,000 cases. Thug, 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 palpitation. Looking at the news, 800 people died today. Thug, 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 palpitation. You heard someone in the next neighborhood died of COVID. Thug, 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 thug. You are having palpitation. You cannot sleep at night. So a lot of anxieties, insomnia, palpitations, as a consequence of the fear and anxieties with this pandemic. And scutellaria, my friends, is a wonderful medicine. You'll find people resorting to conventional psychiatric anxiety remedies, throw those out of the window, prescribe them scutellaria. If you see all the points I've mentioned here, nervous sedative, so you cannot sleep at night, I'm having palpitation. Cardiac nervousness, what do you mean by cardiac nervousness? I'm having palpitation. Even like a weakness after flu. So you can have the debility to a certain extent as well, but not to that extent of Alstonia or Avena. Night terrors, I cannot sleep at night. I'm having panic attacks. So the anxiety, the fear, resulting in insomnia, resulting in palpitation, resulting in night terrors, resulting in polyuria, frequent urination. So stressed out, so anxious, watching the news every day, watching the count, the fatal count, the total cases count go up, I'm having polyuria. Severe headache with anxiety and stress, fear. You have to understand for scutellaria, the key word here is fear and anxiety. Resulting in insomnia, resulting in palpitation, resulting in night terrors, resulting in polyuria, resulting in severe headache. And lastly, sometimes you can get involuntary seminal emissions as a result of this fear and anxiety. My friends, I want you to please try scutellaria. How to differentiate from aconite? You understand aconite is also a remedy for fears and anxieties, for this kind of panic. But you have to understand in aconite, one of the major theme of aconite is the fear of death. But here, in case of scutellaria, the fear of death is not there. But it's just the fear and anxiety of listening people around me getting affected, listening, seeing people dying or hearing those news. And that affects me. And that's scutellaria. How are you affected? You're getting an insomnia, you're getting palpitation, you're getting polyuria, you're getting a severe headache. 6C, 12C, 30C, whatever potency is available, my friends, I want you to try scutellaria. Believe me, you won't be disappointed. Open Boricae, if you have your Boricae with you, have a quick look in Boricae for scutellaria. And I want you to understand this remedy so that you can prescribe. Very many people have asked me this question in the past. Why not aconite? Again, as I shared with you, in case of aconite, you'll find that restlessness is there. You'll find that anguish, that fear of death is very prominent, which you won't find at all in case of scutellaria. So whenever you come across fear of death, you have the mental restlessness is going up and down. What's going to happen? What's going to happen? That's more aconite. But whenever it's, watching today, 800 people died. Somebody next door had COVID. I can't sleep. I'm having frequent urination. I'm having a severe explosive headache. Go for scutellaria. If you see in the introduction, scutellaria is a nervous sedative when nervous fear predominates. Cardiac irritability. What does cardiac irritability mean? Cardiac irritability is the palpitation. If you look in the head section, night terrors, explosive headaches with frequent urination. There's that headache with polyuria, similar to gelsemium to a certain extent. If you look in the male section, seminal emission and impotency with fear of never getting better. You see how a small remedy, but it's so valid in today's conditions. You understand sexual weakness has a lot to do with your emotional frame of mind. And you'll come across people in these few months where they have shared with you, I'm encountering sexual debility, I'm encountering sexual weakness because of the stress, because of the anxieties of what is going around me. If you look in the sleep section, night terrors, sleeplessness, frightful dreams, waking up with panic attacks, and that's scutellaria. My friends, please do prescribe scutellaria and you won't be disappointed. 630, 12C, even 200C if you come across scutellaria will help you. And especially again, my friends, those again who have heard me earlier, I'm sure you have heard me say this, that every one of us, each one of us, those who are joining in, are always skeptical, are always cautious, is the correct word, before prescribing a new remedy. We all have a comfort group of remedies which you always want to use. And as I shared with you earlier as well, the only way to implement new remedies in your practice is by comparative metromedica with those remedies which you use often. I'm sure you have been using aconite day in, day out for anxieties and panic attacks. But in many of those aconite cases, I'm sure you'll come across the patients would have told you I'm having palpitation. Patients would have told you I'm having sexual weakness. I'm having night terrors. I do not have fear of death, but it's just the surroundings and situation around me which is taking a toll on me, and that is scutellaria, my friends. So I want you to please use scutellaria for today's modern day world. Another fantastic medicine which I want you to understand. If you think of the anxieties, the frights and the anxieties of this present day world, as I shared with you, from age 8 to 80, no one is free of that anxiety and fear. Especially think of those geriatric 60 up people who have comorbidities which is so common across the world of diabetes, or they're hypertensive, or they have had a history of asthma in the past. So they're constantly living in the fear and fright. And there's always an anticipation. What if I get that infection? And more than getting the disease, it's the mental health which is totally destroyed in these past months. There have been, every government across the globe have issued advisories for people above 60 and 65 to not venture out. That takes a toll. You are susceptible. You are vulnerable. So that anticipation of getting the disease, that apprehension of getting the disease. And whenever you think of a very deep acting nosode like dysentery compound, remember 3 areas, 3 organs which affect, or 3 sphere of actions for dysentery compound. It affects you in the heart, so you can get palpitation, you can get an oppression, a chest pain, either of these. It affects you in the stomach, you're having loose stool, your consistency of stool has changed, features like irritable bowel syndrome. And it affects you in the nerves, so you're getting twitching in the muscles, chorea, or you're getting a fine tremor. So if you see the top hexagon, nervous tension of anticipatory type. So you're anticipating And especially I found this very applicable in people post 50 who have comorbidities, who have come down with conditions like diabetes or COPD, and they feel they're vulnerable, they're susceptible, and they're anticipating perhaps the worst. Palpitation, chest pain as a consequence of that, a gastric pain or loose stool as a consequence of that, or you're getting nervous tremors or twitches as a consequence of that. So think of cases where you have given argentum nitricum, not working, try dysentery compound. Think of cases where you have given arsenicum album, not working, try dysentery compound. It's a bowel nosor, and dysentery compound is a combination of arginate, arsenicum. And when those big, important polycrests haven't worked for this kind of conditions, dysentery compound will come in handy, my friends. So please do try dysentery compound in this condition. If you see here, anticipatory nervous tension is the keynote. As I shared with you, argentum nitricum, arsenicum album haven't helped you, think of dysentery. How it affects, you see the heart nosode. So as I shared with you, the palpitation, the nerve, the oppression, angina. As I shared with you, the chorea, the neurological tweaks, tremors, and the gastralgia. So like an anticipatory gastric pain, and that is applicable in dysentery compound as well. Please do not miss out in this condition. I'm sure you come across people with this kind of anxieties, but here you have to understand the key word is anticipation. That's why people who are the most vulnerable are anticipating it the most. And hence, dysentery compound will come to your rescue. 200C 1M, a good choice of potency. Sometimes a single dose will help you in soothing the frayed nerves. And that's important for dysentery compound. And the last one in this list, my friends, is Califos. As I always share with you, I do not use repertory. So I cannot tell you of rubrics and sub-rubrics, but I know my Metromedica. And whenever you try and differentiate between Califos and Avena sativa, as I shared with you earlier, Avena sativa, think of Mr. Avena, Mr. Califos, both are working long hours. At the end of the day, Avena sativa will tell you, I'm so bloody tired, I'm so exhausted, but I cannot sleep. That's Avena. Tired and exhausted, but yet cannot sleep. That's Avena. But what Mr. Califos will tell you, I'm working for long hours, but at the end of the day, I cannot sleep as well. Next morning, when I'm trying to concentrate, some deadline which I would have finished in 2 hours, that's taking me 4 or 5 hours. That's taking me 6 hours. People are doing all sorts of video calls, keeping up with friends, meeting friends. I do not like to do that. It's better I stay on my own. Think of a 17-year-old, 18-year-old preparing for his entrance exams, working long hours, still cannot sleep, Avena. But working for long hours, few days, few weeks later, they'll tell you, I could have remembered this subject in 30 minutes or 40 minutes. It could have registered. But now it's taking me 2 hours. Now it's taking me 3 hours. Why? My friends, if you open Borica's Metromedica or you look in any Metromedica, you'll find it's mentioned, slightest labor seems a heavy task. So what kind of labor? Mental labor. It's taking a toll on me. It's taking a heavy task. So whenever you come down with weakness and neurasthenia, post working long hours, especially in this kind of situation where you are stuck, that's Avena. But whenever you are not only getting low sleep, but at the same time, you feel, I cannot concentrate like I used to. I cannot retain that information like I used to. You're gradually going to a Califos state. If you open Borica in Califos, you'll find it's mentioned in italics, mind section. Slightest labor seems a heavy task. Disinclined to converse. So you'll find a very bubbly, extrovert phosphorus turning into caliphos due to the social distancing because he doesn't like to meet anyone. Indisposed. There's a line, indisposition to meet people. And that's caliphos again. So my friends, whenever you come across people who haven't lost their job, who are working equally, not if not even more, and they're coming down with a lot of debility, neurasthenia, it's more Avena. But if they're coming down with weakness, but at the same time, intellectual functionings are getting affected. And that's the exact expression patients will tell you, that whatever I could have done in an hour's time, that's taking me 3 hours. And that's your caliphos state. Slightest labor seems a heavy task. I'm sure you're prescribing 6x to everyone for caliphos, but my friends, I've got very good results with 200C and 1M. So caliphos, make sure, if you feel it's a caliphos totality, make sure you prescribe 200C and 1M. You won't be disappointed. So my friends, with anxiety, I want you to please try out this medicine. Try Scutellaria, that's my number one. With that kind of panic attacks, with that kind of anxiety, the palpitation, frequent urination, that's Scutellaria. I want you to try dysentery compound, heart, nerves, and stomach, where the keynote is anticipation. Remember, the vulnerable are anticipating it the most. I shared with you caliphos. Remember, poor comprehension on one hand, insomnia on the other hand, and indisposition to meet people on the other hand. They don't want to meet people. So that's about caliphos. And I'm sure you'll be benefited with these remedies in the future. Give me a moment. I shared with you stress. I'll be sharing with you a few lesser knowns for depression, and then we'll go to the polycrest. I'm sharing with you the most important ones, my friend, in today's world. I'm sure many of you know about alfalfa as a very useful medicine for low appetite in children. But in today's 21st century, in today's pandemic year, think of an adult who doesn't want to eat. Think of an adult who doesn't want to have the regular meals, lunch, dinner, breakfast. He's nibbling on sweets. So he's sitting in front of the TV, gorging on sweets and ice cream. That's the only thing that makes him happy. And at the same time, he feels gloomy. He feels everything is dark and black. And that's alfalfa. So even in today's world, I want you to open Borica and have a look in the mind section, please. Losing the appetite in terms of for regular meals. You don't want to have a lunch or a dinner. You're gorging on sweets and chocolates. And at the same time, you're feeling very low. You feel the world around you is turning blue and black. If you open Borica, if you look in the mind section, you'll see it induces a general feeling of well-being, clear and bright, so that all blues are dissipated. Blues is the depression. And my friends, alfalfa will help you in this condition where you feel low, you feel appetite has gone haywire, you're having nibbling and sweets and chocolates. At the same time, you're gloomy and drowsy as well. My friends, alfalfa has benefited in these conditions with very effective results. 6C, 30C, even 200C is applicable for alfalfa. And especially, I've used this in the present situation as well. I'd like to share with you another very important medicine, my friends, in today's world. And believe me, we have done thousands and thousands of cases, not only during COVID, but even before that, in a case where the patient is dependent on antidepressants. So whenever you come across cases where there is nervous depression, you feel low, you feel the entire world around you is turning black, and patient is requiring immediate help to counteract that situation where they are on antidepressants. My friends, verbena is your remedy to help in cases to wean off patients of conventional antidepressants. You understand, whenever you prescribe a deep-acting polycrest like an atrium mur or an aurum metallicum, in a case of clinical depression, it will take time to start working. But very many cases you will find where the patient is on antidepressants and is gradually increasing the dose as the day progresses. Verbena can help you in those cases with very, very good results. You have to understand these are small, lesser known organopathics. Why I say organopathics? Which have got specific affinity for different conditions. Herring always mentions this, that for a totality to be complete, you need 3 symptoms. Like for a stool or a chair to stand, you need at least 3 legs for a chair to stand. A chair cannot stand on 3 legs. A chair cannot stand on 2 legs. A chair needs at least 3 legs for the chair to stand properly. Similarly, for a homeopathic totality to be complete, you need at least 3 symptoms. And here you see I mentioned for verbena, it's very small remedy. But believe me, I'm sharing with you because we have had very good results, and you'll find it very effective in cases where the patient is dependent on conventional antidepressants. You see, the key word, it brightens up the patient's mental powers. They feel so dark, they feel so low that whenever you prescribe verbena, it will brighten you up. Insomnia can be there. Sometimes neurological diseases like epilepsy can be there as well in case of verbena. Tincture, again, 6C and 30C are good choice of potency for verbena. And the very useful medicine. These are, if you want to try just few medicines from these organopathics, I want you to try these 2, tanacetum and verbena. Tanacetum, you understand the apathy of living that constant daily circle of life. Half dead, half alive feeling. That apathy, that day in, day out. You're feeling, it's the same life. Again, Sunday comes, Monday starts. You feel it's the same circle of existence. I'm just following the routine. So it's like an apathy which has set in. So it's more than the depression. It's like a clinical apathy where you feel half dead, half alive. Mental fatigue. And that's tanacetum. Very many cases where I have tried phosphoric acid, that didn't help me. I've tried tanacetum with very good results. Again, 30C, 6C, 12C will help you in tanacetum. It's that kind of a feeling. You understand that it's like your soul is half dead. So half dead, half alive feeling is important for tanacetum. So verbena, tanacetum, these are your top remedies, top organopathics, my friends, which I want you to please use. I want you to, if you make a top 5 of organopathics for emotional conditions, which I shared with you, my number 1 in this list is Avena sativa, because you understand not only it helps conditions post-COVID, the debility, but even in cases where people are stuck in their homes and they're coming down with neurasthenia and insomnia. Number 2, looking at the television, looking at the social media, you're coming down with stress and anxiety and palpitation, do remember Scutellaria. So my number 2 is Scutellaria. Number 3, verbena. You feel everything is dark around you, clinical depression. It brightens up the patient's mental power, especially, as I repeat, when the patient is dependent on antidepressants. Patient is feeling low, you cannot go ahead and prescribe an aurum metallicum. Can you? You need a broader totality for prescribing aurum metallicum. Patient is feeling low, you cannot go ahead and prescribe a causticum. You have to respect the polycrest. Whenever you're prescribing the organopathics for depression, and you gradually wean off the patient's antidepressants, you'll be getting a clearer picture later on for a polycrest prescription. Those who were with me in the IHMA seminar last year have heard about me, how we prescribe organopathics, and always in a case of drug-dependent cases where you have a very contaminated picture, natural disease is superimposed by an artificial chronic disease, you start off with an organopathic. Very many cases, when you get a clearer picture, you go off to prescribing a polycrest. So I shared with you Avena, I shared with you Scutellaria, I shared with you verbena. Number 4, tanacetum, half dead, half alive feeling. It's the apathy in this condition, which is important for tanacetum. Again, 6C, 30C, 200C is very useful for Avena sativa, is useful for Avena, is useful for tanacetum as well. And lastly, I'm sure you're using Califos, but I'll share with you number 5 is Califos. With the insomnia, with the poor comprehension and understanding, Califos, I'm sure, will help you. And to a certain extent, if you think of a very extroverted, bubbly phosphorus, gradually shelling himself down, gradually withdrawing himself, indisposed to meet people, that's when Califos comes in as well. So these are my few medicines for depression. I'll share with you my top polycrest, my friends, which you'll find useful in this condition. Obviously, there are a lot of polycrests I'm sure you have been using for post-COVID stress. And whenever I'm using the word stress, it implies a spectrum of emotions. It could be fear and fright. It could be grief. It could be a humiliation in terms of losing work. It can be just the stress and anxieties and the physical weakness which you're encountering day in, day out. I'll be sharing with you a few of my top remedies. As you understand, the time is limited. I'll be sharing with you few of the topmost remedies which I use. My friends, if you haven't used this medicine, I'd like to share with you about Calliars. Think of someone who's working as a physician in the frontline, health worker, who are working in the hospitals, who are working day in, day out, some of your friends, some of your colleagues. So they're very diligent. They are very dutiful. They are very moralistic and routinistic, with a strong sense of responsibility, strong sense of duty, which you find with Kailis. And when these Kailis, say, who are working in the ICUs, who are working as hospital staff, they're seeing death and devastation in front of them worldwide, anywhere in the world. But still, they have nerves of steel and they're going on working with their duties. But when they come home, when they are in the comfort of their bed, they're trying to get some sleep, They remember those images, those gruesome images of people fighting for their lives, for the last breath of air which they can get, fighting for their life and death. Those images of people losing their loved ones. People who are working